Well, good morning, everyone. How are you? And once again, welcome to another live here this morning. And good to be with you. And let's say hello to a few friends before we get into Q&A. Let's see, can you hear me? I'm in a new place here. Okay, I need thumbs up once you come on for sound and visibility. Okay, who's coming up? We got people, but nobody's saying hello to me yet. I don't know if that's me on my end or you guys. Okay, 0 stars received, 72 people on and climbing, 77, but nobody's saying hello. Is that, can you guys not scroll? Or Nick, if you're on, would you send me an email to Dr. Martin, Draw Martin? Send me an email. I got to know, because I don't know if my sound is good or everything is good. Let me see here. Okay. Okay. And nobody in the public. I don't understand that. Okay. Guys, if you can, give me a thumbs up. And if you can't, well, I don't know what to tell you. Okay, I just want to know if you guys are hearing me and seeing me. That's all I care about. Okay. And yeah, well, the crowd is there. And comments here will appear. You know, Facebook has done some funny stuff there recently, and it's changed a few things, so I don't know exactly what's happening. And I'm trying to find out for you. And, okay, let me just see. Is it on? Everything good? The sound good? And let me just check and see, because I can't see any comments whatsoever. So I'm holding on a minute to see. Okay. We'll get to our questions in 1 sec. I just want to see if you can hear me and see me. Okay? Thanks for your patience. And, okay. Okay? Let me just see now. Okay, good. Okay. Well, somebody got back to me, but I don't see any comments. I can't say hello to anybody. Sorry about that, guys. I don't know about that. I'll try and find out after the program. But let's get to the questions. And the first one is from Noeline. And what does Dr. Martin think about a 3-week treatment with milk thistle and Silmarin for 3 weeks for cleaning the liver? Well, can I tell you something, Noeline? I'm not big on, well, look, I'm big on cleaning the liver. Okay? And I'm not big so much on supplementing to clean the liver, because I can tell you in 6 days, if you don't eat any sugars or any crappy carbohydrates, you clean your liver. It's as simple as that. And if you want to clean your liver, another way to clean it is do, and really help. And now Noveline's saying she doesn't have a gallbladder. Let me just make sure I'm reading that right. I have more gut. I have on more gut. I can't fully understand the question. But anyway, at the end of the day, you want to clean your liver, you can do intermittent fasting. One of the best things, look, to get rid of fat, remember what puts fat in the liver. What clogs up your liver? It's fat. And how do you get fat in your liver? Well, it comes from glycogen. And that's storage of sugars. And sugar molecule has nothing to do with fat. So when you eat eggs, meat, cheese, dairy, your liver is working at 100% because there's nothing clogging it. And your big thing for liver is you want to produce a lot of glutathione, okay? Glutathione, which is your body's Velcro. How do you do that? Okay? Keep your liver clean. So intermittent fasting helps because that sort of detoxes the gallbladder. Don't eat at night. You can go 14, even 18 hours without eating. That really helps. The liver a little bit, but more the gallbladder, okay? So, Nolene, if you're feeling sluggish in your liver, empty it. Like milk thistle. I like milk thistle. I got nothing against it. But you can use all the milk thistle in the world. I used to tell my drinking patients, okay, alcohol. Well, I said, you can use all the milk thistle in the world, but that ain't going to repair the damage of alcohol, what it does to the liver. And guys, you know how I equate high fructose corn syrup and alcohol. They're very similar. And that packs up your liver like nobody's business. And that's why we see so many young people and kids even with fatty liver today. So Noeline, that's what I recommend. Empty the liver by cutting the carbs. You're saying you're doing that? Well, then you don't have to work on your liver. Your liver's working great. I can promise you that. Now, if you got liver enzymes testing or ultrasound testing that's telling you got problems in your liver, then that's another issue, okay? Okay, thanks, Noeline. Teresa's asking, why would my hands from my forefingers to the ring fingers at the top joint by the fingertip rather suddenly get swollen and hurt like the dickens, like they got smashed? That's arthritis. Now, it may be, you said you had your uric acid tested. It could be normal, but you still have crystals. So usually at the distal end of the joint, so when you got pain there and swelling and very sore, that's arthritis of some kind. Is it gouty arthritis? Maybe. Is it just osteoarthritis? Maybe. Is it the start of rheumatoid arthritis? Possibly. And, in my practice days, I would have been able to differentiate that pretty quickly by just doing some testing. But those, Teresa, are what's going on. And you need to do the reset. I would recommend you do the reset. 30 days. Jan, can Dr. Martin please pontificate, I like that, Jan, on the benefits of quercetin? Well, quercetin, okay, I love quercetin. That's the color you find in coffee, the bean, the darkness. Fruits and vegetables, they're colors. That's how you get quercetin, okay? Quercetin's very good. New studies on quercetin and the benefits of lowering uric acid. And guys, I've talked to you about this, that uric acid is a biomarker. One of the biomarkers that the Martin Clinic, has added to metabolic syndrome, okay? Quercetin. So, uric acid. Quercetin lowers uric acid, okay? Quercetin lowers uric acid. Why? Well, because of its flavonoid content. You know what else lowers uric acid? Coffee, okay? The real vitamin C. Coffee, that lowers uric acid. So quercetin, uric acid, quercetin, lungs. I used it for lung conditions, allergies over the years, Jan. with grapes. Listen, seasonal allergies, here's my little secret, really effective. Probiotics, because any allergy, you got to fix leaky gut, okay? But if you're always stuffed up and sinuses and you're barking and you got allergies, I love the combination of, and seasonal allergies like hay fever, whatever, quercetin, about 500 milligrams, and Navital. Sometime between 2 and 4 capsules of each. And boy, does it work for allergies, okay? You can go a little bit higher dose if your allergies are really bugging you. Or you got a lot of phlegm in your sinuses, a lot of phlegm in your throat, or a lot of phlegm, mucus in the lungs. Quercetin, okay? Thanks for the question, Jan. Much appreciated. Lise, I've lost a lot of eyebrow hair, and you know me. As soon as you tell me eyebrows, thinning eyebrows, your thyroid, it's sluggish. I can guarantee it. Okay? Okay, let me see what else you say. Okay? Got my thyroid tested and normal. Well, Lise, let me tell you this. Okay? Not that I never looked at thyroid, and if you get my book, Sun, Steak, and Steel, I put a little bit of, I give you one of my trade secrets on how I used to diagnose thyroid. But you know, like my dad used to say, if it walks like a duck and talks like a duck, it's a duck. Okay? And you know what he was talking about? The thyroid. Okay? If it walks like a duck and talks like a duck, it's a duck, okay? The thyroid. Thinning eyebrows, unexplained weight gain, dry skin, okay? Hair loss. I'm very observant because of just I was trained by my father to be very observant. Because you know what my dad used to say to me? Patients have inside information. Number one, listen to them. And number two, ask the right questions. Questions will give you a much better diagnosis. And I was good at that. Plus, my dad used to say, use your eyeballs. Look at people. And guys, like I was traveling yesterday in airports and that, and I'm a very observant. I said, in my head, oh, that woman has thyroid problems. I knew right away. Just by looking at the hairline, sometimes the eyebrows, skin, okay, where they're carrying their weight. Very observant. I was observant in my office. I get you guys a little bit when I tell you about what I was like in my office, right? Like you came in and Dr. Martin, you're in my space. You know, you're in my space. But in my office, I didn't want to sit behind a desk and then you were, 20 yards from me. I set up my office, my examination rooms, and I call them my clinical rooms, where I was sitting very close to my patients. I wanted to observe them, their skin, their eyes. I used to look in their eyes. I wanted to see their tongue. I wanted to see all these things. And you got to be close. Some people tell me today their doctor is looking at a computer and you're behind them. What? What kind of a physician is that? Okay. Anyway. Okay. So you got thyroid and it's sluggish. I can guarantee it. And that was Lise. Get on our thyroid formula. Guaranteed. Okay? Now, Joanne, plantar fasciitis. Well, here's my rule of thumb for any itis. Arthritis, fasciitis, okay? Tendinitis. Number one, start with the diet, because insulin, okay? And I'll post this later. I have a chart I used to have in my office, okay? A big chart of metabolic syndrome, because really that's what I specialized in more than anything else, was metabolic syndrome. I said, do you have these symptoms or conditions? Tendinitis, fasciitis, okay? Arthritis. I said, you got almost invariably, you have insulin resistance. So you got to fix that. You got to fix insulin, okay? And start there. And I like, curcumin, very anti-inflammatory in terms of supplements. Plantar fasciitis, I really like rolling a tennis ball or a ball or a bottle under the foot. Get that arch and work it from the back of the foot to whatever in plantar fasciitis. But I'm telling you, I fixed a lot of plantar fasciitis when their insulin resistance went down. And it's eggs, meat, and cheese. Okay? Get off the carbs. Okay, Monique, can breastfeeding woman take bone broth powder? Absolutely. Bone broth's good for you. Bone broth's one of the best foods in the world. And you make it yourself. It's full of amino acids. It's full of collagen. It's good for you. It's good for baby. It's good for everything. So you make it or we make it for you. Okay? Collagen, our bone broth powder is one of our top products. People love it. Make a Dr. Martin's Perfect Smoothie with it. When you're breastfeeding, wow, that fat and bone broth, all the amino acids, L-glutamine, it fixes leaky gut. It helps to repair the gut. Good for you, good for baby. Absolutely use it. Monique. Susan, like to know about the causes of low onion. And honestly, anion gap, okay? That's usually low levels, Susan, of albumin, okay, in the blood, that protein. And if you have low levels, you got to investigate. I used to tell patients, okay, they're very much connected. So if I see abnormal blood work with albumin, I said liver, kidney, possibly cancer. Okay? You got to get it checked out. But they'll check your liver enzymes. They'll check your kidney function. And you got to make sure you don't have a myeloma or something like that. That's what I look at for that. Susan, thank you. Correcting it, well, look, it depends exactly what, but I mean, one of the best things you can do, I don't want to say I hate to, but I know I'm repeat. The reset. It fixes your liver. It helps your kidneys. It helps your blood because it's nutrient-dense food. Absolutely. Francis, can Dr. Martin explain lipoprotein A levels of 400? I don't care. Francis, I'm sorry. When it comes to lipoprotein, okay, and you got HDL, you got LDL, you got lipoprotein A, lipoprotein, small particles, that gives me a migraine because here's what it means. Nothing. I hate to say it, but I'm very dogmatic about it. The pharmaceutical industry doesn't want to lose its base, its foundation of statin drugs because they're the best-selling drugs of all time. So what do? Well, studies are coming out, a lot of studies. You know what? You lower your cholesterol, what does that do for you? You lower your LDL because that's what they focused in on for years and years and years. You lower your LDL cholesterol. That's what statin drugs do. Crestor, Zocor, Lipitor. They lower your LDL. So what? You know what they found out? Like I've been preaching for 50 years. They're looking for love in all the wrong places. Now, I am not optimistic even for 5 seconds that that's going to change anytime soon. All I want to do is educate my patients so that they can make decisions. All I'm telling you is when you got high lipoprotein A, who cares? What's it going to do? Is it going to give you a heart attack? No. Is it going to give you a stroke? No. But it's another reason, and this is why I've said this years ago. When they started talking about lipoprotein and the small particle lipoproteins and this and that, I said that was another diversion tactic of the pharmaceutical industry to keep people on statins. You're a layperson. What do you know? It scares the living life out of you. I follow some cardiologists, okay? And some of them, lipoprotein A, lipoprotein B, connected to heart disease. No, it's not. And if you really look, no, it's not. It's a diversion. Look, and they mean well. I don't mean for a second, but what they do is they take research that's only done by the pharmaceutical industry, paid for. You pay for something, you expect the results to follow what you want. And I'm telling you, Francis, look, I'm not changing my opinion on it. I read every day. I read every study I can on cholesterol and biomarkers. I'm not convinced at all. At all, okay? It don't mean nothing to me. That's why I don't comment on it too much, okay? Thank you. My friend says they have that high levels and says it's apparently hereditary and diet cannot fix it. Well, who cares? But diet fixes everything. You tell your friend to get on the reset. And I don't care about lowering that number. That had nothing to do. Here's what I care about. You guys know this. What are your triglycerides and what is your HDL? What is your total cholesterol? I don't care. What is your LDL? Well, I do care a little bit about LDL. I don't want it to be low. Okay? But I care about triglycerides and HDL because that'll lead you to metabolic syndrome. And that, if you got metabolic syndrome, you're on the Titanic, you're in trouble, and be careful if your triglycerides are high and your HDL are low. That's what I care about. Okay. Thanks for the question. And that was Francis. Herma. I was just notified by a friend that you could take too much vitamin E. Exercise? I know what you mean. The other vitamin E. Okay? Herma, yes, you could. You could. But come on. Okay? Your friend. Tell your friend that Dr. Martin loves them. But I have never seen a case in 50 plus years. I know why you're sick. You take too much vitamin E. Now listen, I specialized in vitamin E in the 70s. Why is that? Because I took courses from the Shute brothers out of London, Ontario, who were cardiologists who really believed in vitamin E in the 70s. I took courses from them. Smart. And vitamin E for them was everything, especially in heart disease. Okay? Now you guys know me. I've replaced vitamin E with the real vitamin E, which is exercise. Why did I do that? Because exercise is better than vitamin E. Okay? The other vitamin E. Okay? But vitamin E. I've never seen a case. You overdosed on vitamin E. No, you didn't. Okay? But you never hear me talking about the other vitamin E. I'd rather you eat it than take it as a supplement. If you want to, take it. And I guess we have, you're saying, what are you saying there, Herma? We have a little bit of vitamin E as an emulsifier in our supplement of D3 and K2. It's trace. It's a trace amount. Not even enough to put a number on it. Okay? Look, like I said, Herma, tell your friend that I love them, but they're wrong. Okay? Kathy, how long does Navital stay in your system? Up to 72 hours. That's how good it is. You see, you want that. I mean, because a lot of people, if you talk to most doctors, you know what they'll tell you? Most doctors, not all. You take a vitamin, your urine is going to be expensive. Because they think you pee out everything, right? Urine's going to be expensive. And you can tell they never took 5 minutes in medical school about vitamins or minerals or supplements. They know nothing. You might as well go to your plumber. Your plumber would have better advice than your doctor when it comes to a supplement. Because they're scared skinny of supplements. Okay? Especially vitamin D. You're going to take too much vitamin D. Okay? You're gonna get toxic. They've never seen the case. Okay? They've never seen the case, but they still talk about it. Because the college and the medical schools and the pharmaceuticals especially, they pump that vitamin D. You know what? We could have saved the whole world. We could have saved the whole world during the COVID crisis if we would have given everybody and their dog vitamin D and put them out in the sun. But they weren't listening to me. Okay? So, anywho, okay. Navital stays in your system 72 hours. You got traces. This study has been done, by the way, okay, on pine bark. Remember, I went around the world after I wrote a book, The Bark with the Bite. Okay? The Bark with the Bite. I went around the world talking about pine bark because I wrote a book about it. And what it did originally with chronic fatigue syndrome, it was the only supplement, okay? Now you're go back into the late 80s, okay? Long time ago. When I was talking about pine bark extract and I wrote a book about it. The Bark with the Bite. I might even have a copy of that somewhere. Okay. I don't know if I do. I have to go look. Anyway, there's a picture of me in the back of the book. My word. If you don't believe in free radical damage, I was just a young puppy when I wrote that book. Okay? Not anymore. But I talked about the benefits. People ask about that all the time. What Navital? What's it for? Well, it does a lot of things, but the number one thing it does, it crosses the blood-brain barrier and it gives you energy. As in chronic fatigue. Any energy deficiency, Navital, pine bark extract, the best in the world, does that. It's so good for you, okay? Now, And they did the studies, saliva, take Navitol, take a saliva test, it's in the system, take it a day later, 2 days later, okay, 3 days later, still got traces in the system. That's how good it is for you. And yet it's water soluble. It's not like you're going to get toxic. It's not like it accumulates in the liver. It's just good for you. 72 hours. It's been tested. Like I said, I traveled around the world to talk about this years ago. Okay? China, Korea, France, Ireland, okay? You name it, the US of A, almost every state, because I did it, I had a publicist and I was on TV, a lot of TV and radio shows. And in those days, you could do a radio show remote, of course, but TV, you had to show up. And anyway, that was a long time ago. Okay. Okay, let me do one more, because I think we got enough questions. We're going to have to do these Monday. Oh yeah, for sure. I'm never going to get through, because I've been pontificating. And let me see, that was Herma, Kathy, Darvina, okay? I've been taking a collagen and probiotic supplement. Ours? Darvina. Mainly for hair loss and psoriasis issues. Okay. I know Dr. Martin speaks about the many benefits of taking a probiotic for leaky gut. Well, you can't fix leaky gut without a probiotic. You can't. And two, you should be on bone broth. Okay. You say you're on collagen, but you should be on bone broth. Collagen is good, and the best collagen is found in bone broth. And the reason I like bone broth is L-glutamine. It's one of the biggest reasons that reknits your gut. L-glutamine fixes the zipper between the blood and the gut barrier. It allows no garbage to get in your blood. And psoriasis, I can guarantee you, Davina, I guarantee you, you do have leaky gut, and you've got a boatload of fungus, yeast, the Trojan horse that got into your system. 100% for sure. Without even knowing you, I know that. Just all the years of experience, okay? Now, okay? I was wondering if colostrum offers all the same benefits. Colostrum is what mommy gives baby. Okay? Colostrum's great. Supplement, you get many of the benefits in a bone broth. Colostrum is that, the first couple of weeks that mommy gives baby, when the baby starts breastfeeding, colostrum. Do I like it? Yeah. Do I like it as a supplement? I'm not convinced that you get all the benefits. You're much better off with a probiotic, and you're much better off with bone broth. Okay? Probiotics. And Davina, I don't know you, but if you're not taking our probiotic, guys, I mean this, okay? So you can come at me all you want. I know in my office, our probiotics were created out of my practice, okay? And Tony Jr. and I, who saw real people with real problems, psoriasis, eczema, skin problems, lung problems, sinus problems, brain problems, leaky gut, leaky brain, leaky joints, leaky skin, leaky. You know how you fix it? And I could prove it with a broad spectrum probiotic. And every strain in our probiotic, it's a pain in the butt. Our manufacturer, okay, like you would not believe how often they complain. Dr. Martin, would you please change the form? We have to let them grow every strain 8 weeks to make that soil-based probiotic that you want with all the strains that you want. Why? Different strains do different things. And somebody asked a question the other day. Doc, where's your L-reuteri and your L-rhamnosus? No, it's in there. It's in my secret immune boosting formula. That's part of it. Look, the reason we did that is because people were trying to copy. But you know what? It's with Health Canada and with the FDA in the United States, you got to show them all your strains and you got to show them how they're made. And that's why they're so successful and FDA and Health Canada approved. Okay? Why? Because when we say there's 50 billion, there's 50 billion and more. And when we say it gets past the stomach, the acidity in the stomach, we can prove it. When we say it fixes leaky gut, we can prove it. Okay? When we say it gets after fungus, parasites, yeast, we can prove it. Okay? So, anyway. Navina, you're not using ours. You're not using the best. You need to use our probiotic. And that's all the advertising I'll do. Because that's the truth. And I stand behind those products. Because I know how they're made. And I know what's in it. And I know what works and what doesn't work. Okay. We'll finish up on Monday, Lord willing. Okay. Guys, we love you. I'm sorry I couldn't see any of your comments. Who knows? I don't know what happened. And I don't know how to fix it. And I certainly can't do it live. Love you. Talk to you soon.